Hi, Heather.
Hi, Joe.
How are you today?
I'm doing well. I'm really excited to talk about Parkinson's and how we can help the newly diagnosed throughout their um, journey.
Indeed. Yes.
Journey.
So, we are speech language pathologists. We work at the UNC Voice Center. We're going to talk to you today a little bit about some things you might notice with your voice, your speech, and your swallowing.
This was bothering me.
Yeah, me too. I'm glad you took care of
Uh huh.
that. All right. So,
So as you know, we're part of the interdisciplinary team here at UNC, and our roles are really related to voice and speech, cognition or your thinking, and swallowing ability as it changes over the course of your diagnosis. So things that we see clinically is changes to that vocal cords themselves. The muscles don't come together with as much gusto. The edges can be a little bit changed from normal vocal folds. The movement of the vocal folds can be a little bit asymmetric, could make the voice sound like this. And honestly, as all of us take more trips around the sun, aka get a little bit older, our muscles atrophy. And so just the normal changes of aging on top of the diagnosis can have a negative impact on voice function.
right. And one of the biggest presentations that we notice in the Parkinson's patient population is something called hypokinetic dysarthria, which is just a fancy term for lower volume. This can also present with mono pitch, mono loudness, reduction in word stress, breathiness, poor articulation, diminished speech intelligibility, and short rushes of speech. So basically, people are maybe asking you to repeat yourself more often than what you're used to.
And your speech becomes a little less colorful. So, whereas um, you might have been really what is the word I'm looking for when you express something and you are dynamic in your, I don't even know what I'm trying to say, prosody.
Prosody, energetic.
Uh-huh.
Mm-hmm.
So those things can be reduced as well.
All right. So the gold standard, is that right? Should we say gold standard?
I don't know, the most common.
Yeah. And well researched program um, to address these voice and speech related concerns is called LSVT, or Lee Silverman Voice Treatment. Lee Silverman was the pilot participant in this program, which is quite intense. There are 4 sessions a week for 4 weeks, so we do 16 sessions.
Mm-hmm.
But because of this intensity, it is effective. It helps to train those muscles um, through this intense program.
Yeah, so the goal it capitalizes on the principles of motor learning, which a few of them are intensity, repetition, and if you've heard of LSVT or heard of any of your friends talking about going through the program, it is very repetitive, but also saliency, concentrating on things that are of value to you, um, and it trains the brain to think loud. So it retrains loudness and it retrains the person's self awareness of their loudness. And it also helps to improve vocal quality to help you be better understood.
Right. And so this is just a helpful diagram to help understand. So, in fact, it's the feedback loop that regulates volume that is disrupted with this diagnosis of Parkinson's disease. So, oftentimes the individual feels like they're being plenty loud, but they're actually somewhere between soft and very soft. So, going through this program, we focus on loudness. So, you need to step it up a level or two just to be normal or on that low end of loud. So, going through this program really helps the individual to feel um, what it's like to hit that target volume so you're not asked to repeat yourself and you're better understood.
Yeah. Um, there are other treatments. So another one is Speak Out, which is an individual program that also um, coincides with the loud crowd. So um, those are group sessions. They're I don't know a ton about this program because Joe and I aren't certified in it, although
Not
it's on
yet.
my bucket list.
Indeed.
Um, I love that there's a choral singing aspect. There's a lot of research on the benefits of singing and creativity and creative movement in the Parkinson's population. And I know that this program also too concentrates on some of those cognitive aspects, which isn't something that you get a ton of in LSVT.
Correct. All right, and cognitive changes that you may or may not notice. You might notice that you've got um, some changes in your short-term memory or your ability to attend or concentrate on particular tasks, or actually when you're doing those tasks, having a little bit more difficulty executing those. Um, you might notice that you need a little bit more time to process information or to find the right word that you're trying to come up with. So, how would we work on that? What would that look like?
So, in therapy, we really concentrate on what we call in speech compensatory strategies. So, do you want to spend your time remembering what time your partner said they would be home, or, when you've got to mail your granddaughter's birthday card, or do you want to use a calendar or your phone to set alarms and have visual cues so that you can spend time thinking about what stops you want to make on your next European vacation, or the juicy tidbits of the book for book club. So taking taking the things that are less important to be concentrating on and finding other ways to store that information so that you can move about your life in the way that you see fit. Have some fun. It can look at care partner training, like, hey, you know, Susie's having some problems attending to information for long periods of time. So how can we change our family meeting structure so that you're not frustrated that details are being neglected or Susie stops paying attention? So, and really, it comes down to what is important to the patient. And then again, neuroplasticity, like use it or lose it, right? So, if you're having word finding issues, we want you to dive into crossword puzzles and word finds and reading books and word of the day to keep keep those neural pathways strong.
Well said. Absolutely. All right. The last thing we'll discuss are potential changes in swallowing. You may find that you're having a little bit more difficulty swallowing liquids or solids, and this leads to increased meal times. Um, and if you're having some trouble with swallowing and managing your secretions, you might notice a little bit of drooling or some oral residue when eating. And things to really look out for in this context include
Coughing and choking during meals and unintentional weight loss. Um, and if you notice that your cough is a little bit weak, cough is really important because it's our form of airway protection. All mammals have vocal cords. The primary vocal cord function of vocal cords is to protect the airway, not to talk. Although I swear my dog talks to me, just so we're clear.
Yeah, I've seen it.
And so these are things that we look at over time. These are probably things that you're not experiencing now and you may never experience, but one of the biggest risks of swallowing difficulty is what, Joe?
Well, that would be aspiration pneumonia, and that can really make you pretty sick. So if you are noticing that you're coughing or choking, or just having more difficulty with your swallow, we'd want to see you here in our clinic and evaluate the swallow. And there are a couple ways we can do that. One of them is called a fiber optic endoscopic evaluation of swallowing, or FEES, where we pass a camera through the nose and look into the throat. You can see that that second image on the right is what we would be looking at. So we'll have you take some sips of water, some bites of applesauce, so you can see how puree consistency is being swallowed.
And we will dye it blue. Don't be
Yes.
afraid.
And then we'll do some graham crackers as well, which we can't dye blue, and we don't need to because we can see those just fine. But what we want to see is is there any residue or weakness of the swallow? Is there anything at risk of going down the wrong way, right, which would be the airway as opposed to the esophagus? And if there are any kind of strategies that we can work out in real time to help you figure out how to swallow safely.
And so the other form of swallow study you may have heard of is called a modified barium swallow study. And that one's actually done in radiology with a radiology tech and read by a radiologist, but administered by speech pathology. And so if there are concerns that things are going down the wrong way, this is a way for us to see how much and what, and look at the varying consistencies. And so you can see here in picture A, that person swallowed a big gulp of liquid and it's passing straight down the esophagus. In B, you can see where that red arrow is pointing. There's a little bit of food that's just kind of hung up in the back of the throat, indicative of a little bit of weakness, and those are the kinds of things that we teach swallowing exercises to ameliorate, or tell patients to do things like don't eat dry chicken, make sure there's sauce on your chicken, or follow every bite with a sip of water or Chianti. I mean,
even better.
What's a taco without a margarita?
Right.
Okay.
Yeah.
So in figure C, you can see that there's just a little bit of liquid that's sitting above the level of the vocal folds. It doesn't pass below. So we call that penetration in speech pathology. And then in D, you can see that that liquid has dropped below the level of the vocal folds. I'm pointing, you can't see where I'm pointing, but there are vocal folds there, and the liquid has passed between and is now headed down the trachea into the airway.
So these are the ways that we can look at the swallow and help you swallow more safely. And then we've got our email addresses here at the bottom. We went through that a little bit quickly, but let us know if you got any questions.
Yeah, feel free to reach out. It's never a bad idea. Is there anything that we didn't put in the slides? It's never a bad idea to have a baseline swallow study. We tend to, the nice thing about clinic and Joe and I being part of the Voice Center and part of this team is that we have weekly swallow clinics at the Voice Center. And once you are seen at the Voice Center, then your swallow is tracked every, 6 months every year by ourselves and the ENT, and so that we're staying ahead of any trouble that could potentially arise.
Absolutely. Yeah. So we really appreciate your time today, and have a great day.
Bye-bye.